So next we have Dr. Jitendra Jethani will present on measuring peripheral refraction.
Good afternoon, everybody. I think I'm the person who's stopping everybody from going to the lunch, right?
Yeah, I would request Dr. Suhas Aldipurkar to be the discussant for this, please.
So this was one patient who I would be presenting a small case, and I will be showing how we. It's not moving. Slides are not moving. Okay, now it is moving. Okay, so this is a story of a young boy who presented to us with simple myopia. The patient presented post-COVID in 2021 March, and the refraction was minus 1.25 and 1.5. We did the cycloplegic refraction, we did axial length, we did near point of accommodation. All the other tests were normal. Axial length was noted down. We called the patient after 3 months. That is our normal protocol for myopia control clinic. And patient did not come back after 3 months. Once they get glasses, they can see 6/6. They come back at their own time. So patient came back after 6 months, had a progression of myopia. We started the patient on low concentration atropine. So far so good. January 22, patient came back with a progression of myopia. So typically what we do is that we have learned from our previous studies that now we increase the frequency to twice a day. Patient came back on July 2022. Again with a progression. Now here we were stuck. We thought that we thought we need to do peripheral refraction. So the problem statement was how to do peripheral refraction. Now the answer is there is open field auto refractor. We don't have it. The cost is a hindrance. We already, all of us have our own 3 or 4 auto refractors. So this is typically around 12 to 14 lakhs, and we did not want to invest in this. So we thought that we will try to find out an innovative device. I was sitting in my OPD, I drew this with my own hand, and then I tried to make a 3D print out of it. So this was the final device in which we could do the peripheral. So this is basically a handle which has been fitted on the top of the retinoscope with 2 arms. All these have been measured. So at the distance of 67 centimeters, you can get around 22 degrees temporal, 22 degrees nasal. And how do you get it? You get it like this. You ask the patient to look on these 2 fixing targets. Patient can turn his head or patient can turn his eyes. We have a old research paper published in 2008 saying that whether you turn your head or you turn your eyes, it doesn't make a difference in peripheral refraction. So that paper is just to tell that if patient can turn his head, normally we tell the patient to look straight and turn the eyes towards that particular target. You can see whether he is turning his eyes and do the refraction, and mentally you can make up what is the refraction, what is the peripheral refraction of the patient. So this, how did this make an impact? Now we all know that peripheral refraction is and has been responsible, peripheral retina has been responsible for progression of myopia. Now there are specific glasses, DIMS, HALT, Mykido. These are available depending on if there is a peripheral hyperopic refraction. So this is a wonderful article, the first article which was done on. So what they did was they ablated the Macau monkey's fovea and they tried to prove that peripheral retina is responsible for progression of myopia, and this is the refraction of our patient, the peripheral refraction, and we prescribed the glasses to the patient. It was a stylist which has a peripheral defocus, and in December 22, this was in July 22, so we prescribed in July 22. Patient came back with minimal increase in power, so he is still on atropine twice a day. Along with that, we have prescribed stylist. So peripheral defocus lens would reduce the hyperopic defocus and bring it and make it more myopic. So this is one of the first devices across the globe which has been used for peripheral refraction. This is our algorithm as to how we treat a myopic patient, nothing to do with peripheral refraction. Just that, just to complete the slide. Thank you so much. Any questions we can say. Thank you, sir.
Indeed, it's a good paper.
Thank you, sir.
But just tell me, how do you once you know the peripheral refraction, how do you incorporate it into the spectacle?
Okay, so a peripheral refraction of more than 0.75 hyperopic, 0.75 is thought to be one of the culprits for progressive myopia. So typically in a myopic patient, so there have been multiple articles where they have, with an open field autoref, we have given this device to Sumita madam. They have an open field autorefractor. They are trying to do a validative test whether it is useful in comparison to open field autoref. But if there is a hyperopic refraction in the periphery, the theory is that the focus is not on the retina and behind the retina, and that is what propagates the eyeball to progress further. So once you have a peripheral refraction which is more than 0.75 in the periphery, we can give these peripheral hyperopic lenses. Right now, the problem with prescribing DIMS or with halt lenses is that we actually do not have a peripheral refraction device. So we are just giving it because we want to give it. I mean, because there is a myopia progression, so we are giving a myopia control lens. The myopia control lens works on the principle that there has to be a peripheral hyperopic defocus. So that's how it would make an impact.
How big has been your study, or it's just?
No, so this is just we have not done a study. This is just the device which we have made, and we have tried to see the patients. Now we are putting it in the testing phase. We are comparing it with an open field autorefractor, whether this serves as good as a open field autorefractor.
Nice one.
Thank you,
Nice.
sir.
Congratulations.
Thank you.
Any other questions from the judges, or we can? So, okay. So if no questions, then thank you very much, Dr.
you so
Jethani.
No, I have not bought it. So I said we have given it to Dr. Sumita Agarkar. She is a senior pediatric ophthalmologist at Shankar Netralaya. They have got an open field autorefractor.
You tell.
They will be doing it, yes.
Who have not come?